Welcome back to Happiness, a Sceptics Guide with self-confessed self-help abuser Paul Flower and me, psychologist and coach Gary Wood. On we go, sifting the science from the snake oil to find the things that just might make us all happier.
Thank you for joining us for this episode of Happiness, a Sceptic's Guide. Whilst talking about happiness, I suppose we also have to focus a little bit on unhappiness. And part of the reason behind this podcast is that we are aware of the growth of reported mental health issues. And because I think partly this is because we have a kind of greater understanding and a language to describe them. And because I can hold two conflicting thoughts in my head at the same time, I think this is good. It's good that we're having a conversation, and it's good that we're expanding the knowledge of mental health. But I'm also slightly worried that we might be trivializing it a little bit in not us personally, but society as a whole, in that we are giving psychological descriptions for conditions which may not be at that level. And when I think of this, I think of when Stephen Fry said and reported a couple of years ago that he was bipolar. And for a brief period of time, everybody seemed to be saying that they were bipolar, and they couldn't all be bipolar, that some may have depression, like, I would consider myself to have, occasional depression, but I would never say that I was bipolar. I used to think that I was manic depressive, and then I realized I didn't have the highs to be manic. So, it was just standard depression where I was coming from. But the more time we have to think about this kind of thing, the more negative thought we may actually have. And all of us have mental health issues of one kind or another. That's why we're here. And we're defined by how we deal with them. And my big question when we're coming into this from a point of view of talking therapies is, when do you know that you need help?
It's a really good point. And I wish you'd have asked a different question. Right.
Sorry.
First of all, I want to pick up on something that you said, which I thought was really good. It was about the trivializing and about the whole celebrity declaration. But one person's trivializing might be another person's awareness raising. It can be a conversation starter. Now, that's not to say we aren't dealing with an imperfect system. There's loads of research done on diagnostic biases. So, for instance, over here, we might be calling people manic depressive. In the States, it might be a slightly different label. And often things like schizophrenia and bipolar, and there's not a consistency always in how they are, how people are labelled. And there are also class biases, there are race biases, there are gender biases. And if you look, the diagnostic system, it's a framework, but it can be imprecise. But then again, language can be imprecise. So we might use the phrase, one person might say, I'm hacked off today, and the other might say, I'm depressed today. So I think the diagnostic thing, the biases there are a function of how we use language and our tendency to use cognitive shortcuts and labels.
Yeah, so it's a question, they're all subjective, aren't they, to a degree?
Yeah.
So talking therapies, I was reading that 1.69 million people had been referred to the NHS talking therapies in the period April 19 to March 2020. Wow. And that's a massive amount. I mean, and it's great that there's so much help out there. But, is that too many?
Well, the question is, what is the alternative? And the alternative is often to give somebody a tablet. And yes, drugs can help in the short term, but in previous podcasts, we've talked about the idea of emotion-focused coping and controlled-focused coping. So a drug can certainly level things out so we can process better. But does it deal with the root causes? And one way in which therapy has a benefit is that in some way, it tries to look at different strategies.
Which I think is always going to be more helpful. Back in the day when I did seek some help on this subject, and it was a very, very long time ago, there wasn't as much help available at that particular time. And the pharmacological route seemed like the one that they were going to take, and I hated it. So, that kind of ended my search for help via the doctor, if you like. But then at the same time, when I'm in a massive, or what I would consider to be a massive depression for me, the last thing that I want to do is hear myself speak, because I absolutely hate hate everything that comes out of my mouth. So, I don't even want to consider speaking for most of that time. But I think if we dig into a little bit the types of therapy that are generally available, it might help people to understand whether, or to realize whether those things would work for them.
Yeah, because we talked about mindfulness in the last episode. And so mindfulness has now been incorporated into a form of therapy called mindfulness-based cognitive therapy. And we also mentioned CBT, cognitive behavioral therapy. And so if you go to see the doctor, it's most likely you're going to be recommended CBT. So what is it? Essentially, it's a complicated way of talking about thinking and doing. So cognitive is the thoughts, and then the behavioral is the actions, the doing. So it's trying to get us to think about things in a different way and do things in a different way. So if you think in terms of self-help books, the cognitive bit is reading them, and then the behavioral bit would be actually doing the exercises.
So employing the tactics described.
Yes. So talking about unhappiness, it's being mindful and it's acknowledging what's going on, and it's trying to recognize, do I need to talk to someone? Could that someone be my partner, my friends? Does it have to be a professional? And that's pretty much a subjective decision. Sometimes if we feel a bit down, a chat with a friend will sort us out.
Yeah, so I think there's a difference, isn't there, between being a bit down and actually feeling like something is, really affecting both your behavior and your performance, and that is having a dramatic effect on your life. And at that point, you might think, none of my friends can cope or will have the answers to these questions. I need a professional.
As a coach, I get a lot of people phoning me up and writing to me, and they're not sure whether they need coaching or whether they need counselling or therapy. And the way I approach it is I ask questions to determine the degree of personal distress. So if they're crying or they're emotional, and that's getting in the way of everything else, if they're not able to function or they don't get enjoyment out of the things they normally get enjoyment out of, that is a sign that we're not looking at coaching. We are looking at something more like counselling or psychotherapy. The point is it causing personal distress that's getting in the way of your day-to-day life? Are you not able to function?
Sure. So of the 1.7 people who, let's say, in the last reported year were referred to NHS talking therapies, they're going to be receiving a form of CBT 9 times out of 10.
Most likely. It has become the most popular form. It's oversold in a way, which we will come on to, because it tends to work well for anxiety and depression in its milder forms. And it can be administered quite over a brief period. And obviously, when we're talking about when we're short on resources, we want something that's going to work quite quickly. And the thing about CBT is it gives the client some strategies they can use and take away. And that's the key thing. So it's not just you go there and you're fixed. You go there and you have some strategies to manage better.
Okay. And the other, because we're big on acronyms, you've mentioned another one, which is it MBCT or
MBCT? Yeah, that's mindfulness-based cognitive therapy, which we kicked off with. But pretty much CBT is the one that you're most likely to be, well, most likely people ask about it now, which is great in itself, because if you know the brand name of something, so to speak, it's pretty much easier to start a conversation. I want CBT. It might not be that it's the appropriate one for you, but a few sessions of CBT certainly would never do you any harm. It would just give you an alternative way. Now, I'm aware that people are going to think, well, if I'm going to the doctor, there's an immediate idea that maybe it's medicalizing the problem. And I think for many people, that is an issue. And I read, what's his name? There's a clinical psychologist, Stephen Briers. And he talks about therapy in I think it's a really helpful way. And I've got a quote here from him, and it says, people come into therapy because they instinctively feel that the stories they have sought to live by are unraveling. And I love that idea, is that it's nothing wrong with you. It's just the stories that you've used to get you here, or the way you describe the world, is not quite working anymore.
Okay.
Therapy then becomes and his quote again, Stephen Briers, it's to forge a new narrative, and one that interprets the past and opens up more possibilities for the future. So he's put that firmly into the realm of storytelling. And that's not all arty-farty, because you think about when somebody says to you every day, how are you? You tell them a story. You either choose to give them the short version or you give them an elaborate version in all of its detail. But it is a story. You edit it. You decide what you're going to put in. You decide what you're going to leave out. You decide what you're going to emphasize. So therapy then becomes a way in which we can just change the story. You might be emphasizing different things. You might be seeing things in slightly different ways. For me, it's a really helpful way of describing therapy rather than having it a view, there's something wrong with me and it's a medicalized problem. That it's just a way that we describe the world problem.
Sure. So a few years ago, everybody would have, looked for the pharmacological.
That one as well, yes. Pharmaceuticals do it for me every time. Yes. Oh, pass the pharmaceuticals, daughter.
Everybody would have looked for the drug option because Prozac was a big thing.
Yeah.
So, now I think it's healthier because people are, being given more help in kind of looking at the root causes and a solution that may not be drug based. So I noticed that the British Association of Counselling and Psychotherapy has actually 57,000 members. So there's a lot of help out there, really.
Yeah, there are indeed, and that comes onto the way of finding help. So if you go to your GP, although that might feel like a medical route, the GP will be working with people who are qualified and accredited. So they're not going to work with the people, who'll cover you in ashes and roll you in feathers and, and chant over you at midnight.
Although that sounds fun.
It does sound good, actually. Now I've thought we should start up a new podcast. But what I'm trying to say is that the doctor, the family doctor will have done some of the work and they will have someone accredited. If you don't want to go down that route, you can go privately. Therefore, you've got to do some of that work yourself. So it's not a good idea, for a mechanic. You wouldn't just look at the first person that you find on the internet. You do some basic homework.
The thing is, though, a lot of people do look at the first thing that they find on the internet.
They do. That's it. I mean, we are in the internet age, so everybody who's on the first page is the expert.
Yeah, absolutely. And this is, when I've been in the entertainment industry for a long time and in live music for a very long time, the problem that we have with secondary ticketing for live music events is mostly because people look at the first route to a ticket they find on Google or other search engines. And that's the reason we have the problem, because people are not going to, sufficiently sophisticated to find the best ticket and the best provider of that ticket.
And I think a lot of people just do not know the way that the internet works. Is that
But I think what's good is what's good now, and what you've talked about going to your GP is, I think in the past people might have been a little bit afraid to go to their GP. Their GP might just say, "Oh, pull yourself together." I'm pretty confident that doesn't happen anymore. They're going to find the best route to help you out.
I'm pretty sure most GPs will be working with other kinds of professionals. We have much more moved to that more holistic approach. So going back to the idea that, the internet is not always the best source, it's helpful if you find something like a directory website. So that there would be like a counselling directory or a life coaching directory. And what happens is that the directories have done some of the work and asked people to prove their credentials in some way. Another way is to look for the main accrediting bodies. So you've already mentioned the British Association for Counselling and Psychotherapy, BACP, and another one in the UK would be UKCP. Different countries will have different bodies. But if you look at those, they have done some of the validation. So these people are qualified, because anybody can pretty much say they're a therapist.
This is true, because in the UK there's no statutory regulation. You can call yourself that without any training whatsoever.
I don't want to name the person, but there's a famous Hollywood actor whose mother claimed to be an expert in rumpology. And what you would do for a rather small sum You would photocopy your rear end.
Okay.
And you would fax it to her, or, you know, in the olden days. And she would give you a reading based on a photocopy of your ass. And she charged for that as well.
Of course.
And I'm not aware that there is a statutory regulatory body of rump readers. So the point is that there are some weird...
I can use that as an excuse in future years, I'm sure. Sorry, I was just trying to read your rump.
Yes. Well, I think we're skirting on thin ice here. Right. So the point is, beware of practitioners who claim to be the only practitioners. You know, people you find on magazine TV shows of a morning who claim to be the only practitioners of this. And there's a reason that they're the only practitioners, is because they've made it up and they're not part of an accrediting body. So that is a really important thing to do. If you're going to go down a private route, do your homework.
Absolutely. I can't reinforce that enough. And if that's the only thing that you take away from this episode, it is a very important thing to take away. Do your research.
So the next thing, once you've decided you need some help or you want to talk, is which ones do you go for? And we've already mentioned CBT, which it's become the panacea for all ills, a bit like mindfulness has. And if you look at research outcome studies, what you find is there's something called the equivalence paradox. And all forms of therapy perform in pretty much the same way. Proper therapy. And what the researchers have isolated, there are some common factors. One is the relationship with the therapist. So if you kind of have a rapport and you feel the therapist, gets you and you can talk to the person, then that accounts for about 30% of a positive outcome. There's placebo, hope and expectancy. So just the fact that there is some hope that there could be the light at the end of the tunnel kind of makes you start to look maybe for the more positives. That's about 15%. Specific techniques only account for 15%. So it doesn't pretty much matter what therapy you choose. You're kind of in the same way you're forming a relationship with the therapist. You're looking at what actually does appeal to you. The biggest factor is personal resources and life circumstances. So it's what the individual is bringing. So first of all, life circumstances that we've talked about, some things that we can't necessarily control, but personal resources, how we might view things in different ways, how we might use our strengths and skills, how we might use our values. So all of those things can contribute to a positive outcome.
Okay.
You lost for words there, aren't you?
No, I am. I read this in your book earlier on, The Psychology of Wellbeing, of course, by Dr. Gary W. Wood. A very useful book. It's a very slim volume as well. You can get through it in less than a week. It is very slim and wiped down cover. So, because I'm a messy eater. Yes.
So the takeaway would be that when we're talking about unhappiness, first of all, it's being mindful and acknowledging what is going on for you, and then looking for different ways to think about things and to different ways to experiment with different behaviors and different approaches to kind of get some fresh input. And then it's about hoping to create a different way, a different story of explaining what's going on for us.
Yeah. So coming back to how we kind of started this off, which is, when do you know that you need help? You know yourself, I think. If you think you need help, then you probably do need it. And very fortunately, there is a lot of help out there, and there is no stigma attached to searching for it.
If you think about, you watch Olympic events, all of those athletes would have a coach. You talk about successful business people, all of those would have had a mentor. You talk about anything that was ever created in the world ever, and a conversation would have started it. So conversations are at the heart of civilization. So why should we be above it? We're part of it. And if it takes a celebrity talking to get us talking, so be it. So it's to embrace it, have a talk about it. If it doesn't work for you, that's fine. But at least you've given it the opportunity, and you will have thought about things in a different way. That's the key thing.
Brilliant. Thank you. I think that's a really useful and helpful episode. I think it'll resonate with quite a few people. We will be looking further into self-help over the next couple of episodes. So the self-help book and how to read it. And that doesn't mean just open the page and start reading, but how to get the best out of it, and different practices in self-help. So those are the upcoming episodes heading your way shortly.
Thanks again for joining us. That was and is Happiness, a Skeptic's Guide with Paul Flower and me, Gary Wood. Remember to hit the subscribe button wherever you find your podcasts so you'll be the first to know about new episodes.
And if you've really enjoyed it, you can support the show at buymeacoffee.com/Skeptics Guide.